Kacheliba, West Pokot County, home to close to 156,000 people, that also hosts a silent killer that stalks the lives of residents every single day and night. It was the scene of a spirited militia war a few years ago, and now this troubled land is facing another quiet battle, Kala-Azar, a disease that is slowly ravaging this vast area, with children being the most affected, especially the boy child. Kala-Azar, also known as visceral leishmaniasis, is a disease caused by parasites found in the female sandfly. Its symptoms include enlarged spleen, loss of weight, fever that lasts for weeks or months, and more often than not, anemia. 8-year-old Kisang Lumarik is not a visitor here. Ordinarily, the young man could have been in class or at the playing field kicking a ball on the warm afternoon. We paid him a visit. Instead, he lay on his hospital bed, oblivious of the happenings of the outside world he last experienced 6 months ago.
When they sleep near these sandfly habitats, they are actually more susceptible to the bite than those girls who are at home.
Like any other Kala-Azar patient, Kisang developed a prolonged fever and an enlarged spleen. Convinced that her son had been bewitched, his mother administered a regimen of herbs and other concoctions to heal him. Kisang is now confined to his hospital bed as his counterparts rush to school every morning, despite having successfully completed his 17-day dose treatment that includes 2 painful injections. This after he developed a rare condition known as post-Kala-Azar dermal lesion, PKDL, a drug-induced complication characterized by a highly contagious and stubborn skin rash.
If not treated, they can continue to increase in size and they get matted together to form maybe some form of ulcers or wounds. So these wounds, they are actually potential hosts or places where the sandfly can pick the parasite.
For Kisang, the painful jabs will continue for the next 30 days.
It's until the rashes disappears or clears, it's when you stop the treatment. But now, depending on the type of drug you use, there is that maximum dosage that you can give with a certain drug.
Join me tomorrow for the second part of Pokot'S Silent Killer, as I tell you why Kala-Azar patients will continue to suffer due to the low levels of funding set aside for the treatment of the disease. Gloria Milimo, K24 Evening Edition.